When we wear our masks or face coverings, you protect me and I protect you from the spread of COVID-19. But for the best protection against the coronavirus, we must wear and use our masks or cloth face coverings correctly. All persons over age 2 and who can remove their masks themselves should wear one. Before putting on your mask, clean your hands. Your nose and mouth should be covered with no gaps between the mask and your face. Do not touch the mask when wearing it. If you do, clean your hands immediately. Replace your mask when it's damp. Discard disposable masks immediately after use, or wash reusable masks frequently. When removing your mask, do not touch the front. Remove your mask from behind, discard, and immediately wash your hands. Let's protect each other from COVID-19 and wear our masks.
Good evening, Bermuda, and welcome to members of the media who have joined us here at the AV Place this evening. I'm joined by the Minister of Health, the Honorable Kim Wilson, who will be providing an update to the public on the latest from her ministry, including changes to our rules surrounding travel to the island. Following that, I will give an update on matters related to our border opening and training opportunities that are available to Bermudians so that they may re-enter the workplace. First, the Minister of Health. Minister?
Good evening, members of the media. Yesterday, there were 1,483 test results received by the Ministry of Health, and none were positive for COVID-19. Bermuda has had 223 total confirmed positive cases, and their status is as follows. There are 20 active cases who are all under public health monitoring, and none are hospitalized or in critical care. The total of 194 have fully recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 54, and the age range of all of our positive cases is from 7 to 101 years. The average age of all of the deceased cases is 74, and that age range is between 55 and 91 years. Overall, 46% of the cases were black, 47% are white, and 7% are unknown or other. The source of all local cases is as follows. 111 are imported, 91 are local transmission with a known contact, 21 are local transmission with an unknown contact, and none are under investigation. Bermuda's country status remains at sporadic cases, and the 7-day average of our real-time reproduction number is less than 1. It is anticipated that in the near future, in a matter of days, we will be having new entry requirements with respect to testing requirements for visitors. And as such, all visitors will have to secure a negative PCR pre-departure test that is no older than 5 days prior to their arrival in Bermuda. Right now, the testing period is no more than 7 days before departing. However, as the availability of pre-departure testing has improved and the number of imported COVID-19 cases is slowly increasing here in Bermuda, we have decided that it is an appropriate time to make that change now. But we will continue to evaluate this protocol on a regular basis and adjust it as necessary. That are studying overseas that are more likely to be coming home this month and next to visit family and friends, vigilance around returning travelers, and compliance with the mobile quarantine provisions is particularly important. I want to emphasize that mobile quarantine requires that a resident or visitor with negative COVID-19 PCR pre-departure and arrival test results must still test on day 4 and day 8. Likewise, a resident or visitor with a negative day 8 COVID-19 test result must still test on day 14. As the Minister of Health, I remain concerned that some travelers believe that 2 negative tests means we're fine, we can do anything. But just to be clear, this is not the case. There are restrictions that apply to returning residents and visitors regarding their movements and activities until they have a negative day 14 test result. For example, a traveler with a negative pre-departure test and a negative arrival test can dine outdoors but not indoors and cannot visit a bar or nightclub. After a negative test result on day 8, travelers can dine indoors but cannot play, for example, a contact sport, even if it is played outdoors. That person also cannot attend a large event, such as a wedding. Our community is protected only when everyone does their part and plays by the rules. Stay safe, Bermuda, and as usual, I wear a mask to protect you, and you wear a mask to protect me. Thank you.
Thank you, Minister Wilson, and I appreciate the work that continues to be done by your team at the Ministry of Health. Given the greater availability and speed of testing overseas, it is reasonable that we adjust the time allowed for pre-tests for arrival on the island down from 7 days to 5 days. It is important to note that the government of Bermuda is finalizing, through the Bermuda Tourism Authority and the Ministry of Health, is working to agreement with a large nationwide chain in the United States to provide for additional testing options for travelers who may be coming to Bermuda. It is important to note that 40% of our imported cases have had pre-tests on day 6 and day 7. The tourism industry recognizes the need for this change, and it's important to note that Bermuda still offers more flexibility than a number of other jurisdictions who require a negative pretest within 72 hours of departure. These changes are necessary, as globally we've seen an alarming rise in coronavirus cases. This increase in cases globally was also seen locally as we witness a spike in imported cases over the last 4 weeks, with our 7-day daily average of new cases hitting numbers not seen since the spring. While there has been this increase in imported cases, it is worthwhile to provide data and context so residents can better understand the reality of the management of this virus on our borders. However, before I provide those statistics, I must say that although I've said so previously, it is worth repeating that our public health officers at the airport are doing a tremendous job. They are accurate, thorough, and fully immersed in their role, and we are very fortunate to have such a dedicated team on the front line of our fight against the coronavirus, and every resident should be grateful and proud of their diligence. The airport reopened to scheduled commercial flights on July 1st, and the latest analysis considers data between the 1st of July and the 12th of November. The assessment provides an accurate picture of the number of cases, the source of the increase, and informs any changes in travel policy for the country. Since July, 24,000 passengers have arrived at the airport, and only 66 of those 24,000 passengers tested positive for the coronavirus on or after arrival. That means just over 0.25%, or 0.27% of arriving passengers were infected or became infected. Breaking that down on a month-by-month basis, in July, the positivity rate was 0.36%. In August, it fell to 0.17%. In September, the positivity rate hit its lowest, measuring at 0.13%. In October, however, the positivity rate tripled the amount that was in September, measuring in at 0.39%. And as of last Thursday, November 12th, the positivity rate for November was tracking at 0.38%, though that number would have come down slightly, as there has only been one positive case that has been reported in the last 5 days. While 66 infections is a large number for a small country, it is important to note that these are all imported cases. The 66 of them are all imported cases, and our stringent testing program catches almost all cases. It is important to note that the positivity rate that we observed in October is almost the same as what we observed in July. There were less cases as few people were traveling. However, the positivity rate of 0.36 in July is just a little bit lower than the positivity rate of 0.39 in October. What we have seen, which has been different, is an increase of travelers testing positive on day 4 and day 8, which some will assume that means that individuals possibly are contracting the virus at some point in time during their travel, not necessarily on the airport, but possibly before the airport, or before, of course, they after their tests or before they board the airline. This is why, as the Minister of Health said, that it is essential travelers observe mobile quarantine rules, making sure they maintain physical distance and not going indoors in large gatherings until they are permitted to do so. Like every protocol, the mobile quarantine policy was established to strike a balance. It accounts for a situation where, given previous negative tests, someone will likely test negative on their test after their negative arrival tests, but there is still a possibility that they may be an asymptomatic carrier of the virus, and therefore it's important that all that can be done by these travelers to minimize any possible transmission of the virus. The information about mobile quarantine is distributed to all arriving passengers at the airport, so every arriving passenger is aware. However, for those who need further information, there is a Tips for Mobile Quarantine flyer that can be easily found on the website coronavirus.gov.bn. However, our most effective weapon in the fight against the coronavirus is Bermudians remaining vigilant and continuing to follow protocols. We all know what it is: wearing the mask, good hand hygiene, and maintaining physical distancing when you are unable to, and maintaining physical distancing. While some may question the need to continue to be so wary, and I've seen a few persons who keep on speaking about there are so few cases, why do we have to keep on doing this? It is just the reminder that it's the catch-22. It's the chicken and the egg. The reason why there are so few cases is because we continue to do this. And if we stop doing this, then we'll see what has happened in other places where they do not have the strict rules that we have here in Bermuda. For all our successes at the airport with arriving passengers, the government has been alerted to several gatherings, social events, and other functions where attendees have been indoors and have not been adhering to the protocols. I have said that repeatedly every week, that this is not the time to get complacent, and this is not the time to slack off. I certainly understand COVID fatigue. I get it. I get tired of wearing a mask as well. It is not fun to continue to maintain physical distancing. I actually got in trouble at the supermarket the other day as I forgot to wait behind the line and someone reminded me. That's the challenge that we have. But here's what I want to remind everyone, that we cannot, especially at this time where we've seen an increase in imported cases, tests on day 4 and day 8, and what is happening all around us with the coronavirus, to get weary. We have an enviable record, and the only way that we're going to maintain that enviable record, maintain our record of almost no local transmission, is to continue to follow the protocols. As it only takes one person or one couple to infect others at a gathering and lead us back to a place of restrictions like we are seeing in so many other countries. I have said in the past that many Bermudians are facing a very difficult and uncertain time. Many are unemployed and in need of additional financial support. For some, more than one person in a household is unemployed, and they don't know where they will find funds for everyday necessities. I want to remind all Bermudians that there is help available. We have said on numerous occasions that this government will not let people go hungry during this pandemic. If you need help, contact the Department of Financial Assistance, as there are processes that are in place to ensure you receive the support that you need. The uncertainty of not having a job, the stress of worrying about the coronavirus, and the significant changes that have taken place this year alone have created a great deal of stress, leaving many feeling anxious, depressed, and in some cases, extremely isolated. If you are experiencing any of these feelings, please reach out and get some help. There are professionals available who are able to hear your concerns and help you to deal with the feelings that you may be having. The phone number is 543-1111. I'll repeat, 543-1111. And professionals are on the line, able to answer and speak to you to make sure that you take care of your mental health. I now wish to address the reality that some persons are facing about their prospects for future employment. We did speak about the funds which have been made available for financial assistance. But as we all know, Bermudians are working people, and we have survived for well over 400 years in the middle of the Atlantic Ocean because we are hardworking, creative, and industrious. I believe that part of our DNA means Bermudians want to work and not to be supported by the government. Accordingly, the Minister of Labor recently announced the government has added 40 occupations to the closed category for work permits. That means that there are 40 jobs and careers where work permit applications will not be entertained to ensure that Bermudians who have been laid off can find their way back to work. I also wish to speak about job training programs that are on offer at the Department of Workforce Development, particularly as the deadline to sign up for these courses are quickly approaching. The department is offering training courses in computer literacy, administrative assistant, certified cleaning technician, hospitality, food and beverage, digital literacy, landscape gardening, and they are also running a graduate training program for recent college graduates. For people who wish to begin or enhance their computer skills, the department is offering a computer literacy course that will give participants access to over 300 courses that are geared to produce proficiency in Microsoft Office software and the Microsoft Windows platform. The deadline to apply for that course is the 27th of November. In partnership with BEDC, the department is also offering an administrative assistant course that is ideal for those who may currently have low-skilled jobs that may not pay them enough to meet their responsibilities, or for persons who have lost learned skills and duties of a 21st century administrative professional. And the deadline to apply for that course is also the 27th of November. These days, companies, organizations, and other venues are far more aware of the need to disinfect and sanitize areas and the need for overall cleanliness, especially in light of the pandemic. Accordingly, the department is offering a course entitled An Accredited Cleaning Technician. While there are many after-hours jobs that are tidying for people who graduate from this course, persons will, upon graduation, be certified for a career. And the deadline to apply is the 27th of November. In another valuable partnership, the department and the Bermuda Tourism Authority are offering the Learn to Earn hospitality course that is ideal for those who wish to enter the food and beverage industry. The course will teach skills and provide a solid foundation as well as practical on-the-job training. And the registration deadlines are the 27th of November. For those who have rudimentary computer skills but need to enhance their skills in the digital realm, the department is also offering a digital literacy course. This course will teach participants about the Office 365 suite of software, and the course will also provide an element of job readiness to assist course graduates to attain greater employment opportunities. And the deadline to apply for that course is also the 27th of November. Landscape gardening is one industry where we have a large amount of guest workers. It may be because while most Bermudians have cut grass in their youth and perhaps in their adulthood, gardening is far more a serious endeavor. Knowing trees, plants, shrubs, their seasonality, and other elements will be taught. Those who prefer to be outdoors, or for those who want to enhance their skill set from cutting to designing and from planting, will greatly benefit from the department's landscape gardener course. And that deadline is also the 27th of November. And finally, for college or university graduates who have not been able to find full-time employment, the department is running a graduate trainee program their chosen field or industry. They'll gain benefits from experts in their field, build a personal brand, and find out what it takes to thrive. And the deadline to apply for that is next week, Monday, the 23rd of November. So whether you require financial assistance or retraining due to redundancy or the downturn in your industry, the government is providing avenues for Bermudians to restore the personal pride and dignity that comes from working and earning a wage. This government is working and doing all we can to keep Bermudians safe and employed during these unprecedented times. The Department of Workforce Development, the Department of Financial Assistance, and the Bermuda Economic Development Corporation are all working to aid employment. Government departments and agencies will continue to work together to develop programs that will attract new business to our shores and find ways to diversify our economy, while we train Bermudians for employment opportunities while they are developed. That ends my update for today, and I'm happy to take any questions or questions that are directed to the Minister of Health.
Premier, we'll start with Bermuda Broadcasting.
Okay. Good evening. Health Minister and Premier, how concerned are you about the rising number of cases in the U.S.? This last week, they averaged 153,000 cases per day.
Well, it's certainly something to be concerned of. I mean, we all watch the news. However, we recognize that with our borders being open and with an increase worldwide, not just from the United States, of COVID tests, positive cases, that there would have been an increase. We would have naturally seen an increase of positive cases here arriving in Bermuda from those type of jurisdictions, such as the United States. However, as we've said previously, the testing regime that we have, which is quite aggressive, we are able to do proper surveillance, so to speak, at the airport and to assist in better identifying persons that are traveling with COVID prior to their arrival, having obtained it prior to their arrival, and identify them here in Bermuda so that we can minimize the impact of them transferring that particular virus within the community. That is particularly why we're looking at the situation as it relates to the travelers' departure test, the pre-test, prior to. We'll be rolling this out very, very soon. But heretofore you could have a pre-test that's 7 days old prior to arriving to Bermuda, and we're going to minimize that time and make it 5 days, simply because of the comment that you just raised with respect to the concerns that we're seeing in increased cases, particularly coming from the United States.
The only thing I'd add to that, Don, is certainly we are concerned, but we're also confident that our stringent test regime will keep the country safe.
Okay, thank you. Health Minister, we got a bit of good news this past week with Moderna announcing a vaccine that's nearly 95% effective. With the arrangement Bermuda has with PAHO and the COVAX facility, will we have a choice between whatever number of vaccines are developed?
What the arrangement with respect to PAHO through the COVAX facility, as well as Public Health England, is we will be able to have sufficient supplies for at least 20% of our population through PAHO, and likewise through Public Health England. We've been assured that the proportion amount of vaccines that are supplied to the United Kingdom will also be supplied to the OTCs such as Bermuda. At this point, it looks like we will probably be able to have access to all three: the Pfizer product, the Moderna product, as well as the AstraZeneca product. These vaccines are made up of different components. One of them is the actual virus, which will not necessarily be proper to administer to persons that have a compromised immune system or other types of ailments, whereas the other one doesn't actually have the virus in it. So we will be fortunate enough to be able to acquire all three of those.
What problems does it present? Because the Pfizer product has to be stored at Antarctica temperatures as compared to the other two products, and trying to plan to make sure that we have the facilities to have that.
We have already sourced and ordered sufficient refrigeration units that will be able to hold them. I believe they can hold up to 30,000. Don't quote me, but we have more than sufficient, and they're en route as we speak.
That's great news.
Yeah.
My last question for tonight. 2 weeks ago, we saw the quarantine of all the passengers on a BA flight because 10 passengers had contracted the virus. Is 10 now the benchmark for a flight quarantine, or is there a lower number for Canadian American flights because they approximately have 50% less capacity than the BA flights?
The number 10 is actually not a benchmark. It just so happens in those particular circumstances, the close contact is normally determined by 2 seats above, behind, to your right, and to your left. That's the circumference of the close contact to the case. In this particular instance, there were approximately 60 persons on the plane, and by the time that they did the assessment following 10 persons with that close contact that I described to you, it was determined that it would be more appropriate to quarantine the whole plane because everybody effectively was in close contact. But 10 is not a magic number. It depends entirely on the circumstances of the case and how many positives and where they're situated, et cetera.
All right, thank you very much.
Excuse me. Excuse me.
Evening, folks, and thanks for having us. Kind of retracing Don's question here, but Health Minister, do you know if COVAX has signed any specific agreements with either Pfizer or Moderna for the vaccines?
My understanding is that COVAX were looking to acquire whichever one was produced first. I don't know all the particulars. It was something, like I said, that's being organized through the Pan American Health of our desire to obtain the vaccine as quickly as possible, and we were provided with an invitation to pay for the vaccines into the COVAX facility. We immediately jumped to it. That was arranged before we had heard any word from the United Kingdom indicating that Public Health England would be supplying them.
Okay. In terms of, I guess, can you tell us a bit about when we speak with the UK on providing vaccines to Bermuda, what is that discussion? Who do we speak with, and what types of conversations have we had recently with UK authorities?
Well, I'll yield to the Premier because he's the one that's in direct contact with Government House. However, I can also say that through Public Health England, we, as recently as today, we're communicating with them through the Office of the Chief Medical Officer and Public Health England just to ensure that we had the sufficient refrigeration requirements and so forth. But insofar as the other arrangements, that would have been dealt through the Cabinet Office and Government House.
Can you repeat your question again, Jonathan?
Sorry, sir?
Can you repeat your question again?
I was curious to hear when we have discussions with the UK on acquiring the vaccine from their supply. What are those discussions? Who do we speak with? Who on our side, and who do we talk with in the UK when we have these conversations with them?
Thanks. Our contact is through Government House, who is Her Majesty's government, the Queen's representative here in Bermuda. What I can say on this measure is that the United Kingdom made the offer to the overseas territories directly, so it was not necessarily a request from us. As the Minister of Health has indicated, the Cabinet took action on the COVAX facility the minute it became available to make sure that we could take our maximum allocation of vaccine that was being made available. It was an additional bonus that the United Kingdom had committed to provide to their overseas territories the proportional amount of virus for their population. So, for instance, if the United Kingdom secures a amount of virus that is in proportion of 20% of their population, they will supply Bermuda with enough virus for 20% of our population as part of that. So they're doing it as I would say, I guess, a United Kingdom and overseas territories wide thing. So it's certainly something that is welcome, and we look forward to receiving that proportional share from the United Kingdom as promised, in addition to the COVAX, the matters which will come back from the COVAX facility, so that we can get as many persons who wish to receive the vaccine in Bermuda as possible.
Thank you. I guess following on that, when that happy day comes, who will actually be administering vaccinations to people? Is it hospital staff, Department of Health? Are you able to tell us a bit about that?
Those particulars are being worked on as we speak, but it would likely similar to how the flu vaccine has been administered. So we have the public health officers, the Department of Health, that would administer them. No doubt doctors' facilities will also receive sufficient supplies, as well as rest homes and the like. As I mentioned previously, Jonathan, the intent certainly is to administer the vaccine, have it made available to persons within the health field first and foremost, our frontline workers, as well as vulnerable populations such as seniors.
Thanks. We talked about having open borders and our stringent testing. but we are seeing the cases really taking off in the U.S. What point is there a point where we look at restricting travel, whether it's from certain cities or limiting the ability of local people for travel to these hotspots where the virus cases are really spiking?
You want me to handle it?
Yeah.
The short answer to your question is no. There is no actual limit. We are confident that the requirements of which we have set out are effective. The challenge which we have, of course, Jonathan, is not necessarily travelers who are coming to Bermuda to travel overseas and bring back the virus because they are not required to have a pretest. As the Minister of Health, who is a lawyer, reminds me on a regular basis, that as much as I want to say that every single person must have a pretest prior to coming on a plane, the advice which we currently have is that legally we cannot bar residents from re-entering the island because they don't have a pretest. And so that is presenting a particular challenge. For those persons who do not have a pretest, they're required to wear a quarantine monitoring bracelet and be in quarantine for 9 days. That is what we currently have. There will be a question as to whether or not there is a need to extend that or not to extend that. But right now, we believe that that is sufficient. And as long as residents abide by that, it should be fine. But there are certainly new restrictions that have been announced today. And we're exploring further options to make sure that without question, residents will not bring more virus back to Bermuda as they travel returning without a pretest. It is a very big concern, and we are looking at all legal possibilities to find ways to continue to protect the country and reduce the amount of persons who will be carrying the virus into Bermuda.
Thank you. So you did make mention of being in contact with a nationwide chain in terms of testing. I wonder, is there any chance you could elaborate on that, who you've been speaking with?
We're not going to
That's
elaborate now. I want to make sure that it is finalized. I'm not familiar. I mean, I just got off the phone with the Bermuda Tourism Authority. They said it advanced. Is it at a point toward disclosure or no?
We're in the final stages of the discussions with this particular chain. It's a chain that everybody knows about and you've probably been there several times yourself. The advantage is that because it is widely, it's a chain that's widely accessible within the United States. It should be no difficulty pose very minimal difficulties for Bermudians that are traveling overseas to be able to access the PCR test through this particular chain, and they're indicating that they can have the results in 48 hours.
Right. I guess my last one, we've seen British Airways stop serving the island for a while. Do we have concerns of any other, or have we heard of the possibility of any other airlines doing something similar?
To date, no, we have not. But we continue to monitor and to keep in touch. Certainly, we look at all our air routes, and we want to continue to support our hospitality industry as best as possible. So, as I had just indicated, I was speaking to the interim CEO of the Bermuda Tourism Authority, Mr. Glenn Jones, on just a few matters prior to this press conference, so I could be brief to provide any answers to questions which may have come up. But at this point in time, we have not seen any other airlines that have indicated any changes. We are continuing to make sure that we promote Bermuda. We are continuing to recognize it as a safe jurisdiction of which to travel. We are continuing to see, certainly from the United Kingdom, increased interest in the work from home. Persons are now, because they're fearing lockdowns that are going to start happening inside of the United States due to the surge there, are looking to, and additional inquiries have come into the government of Bermuda as late as today, on more persons and high-profile persons that are looking to relocate to the island as an oasis away from the seemingly, I would say, ravaging pandemic situation inside of the United States. But on an overall basis, we remain confident that our air travel corridors will remain, and I think the restrictions of which we have in place have served us well, and we will continue to make sure they're enforced.
Thank you kindly.
Good evening. We've discussed vaccinations.
Good afternoon, Trevor. How are you
Good
doing
evening,
today?
Premier. How are you?
Lovely.
Will you, Premier, or the Minister be receiving a vaccination if once they've been made available?
I can personally say that I'm not saying I wish I was old, but yes, I would. I know that I won't be in the priority
List.
demographic, but I certainly will be, yes.
unquestionably, Trevor, I will be getting a vaccine as soon as the Minister of Health allows me to do so. Dr. Weldon has assured me that mRNA vaccines are safe, and they are, of course, a new and different type vaccine following their approval processes and verification of safety. I will be happy to set the example for the country.
Are you relieved that this today, after no new cases, it's been a little somewhat quiet with new cases after a spike? Are you relieved, or are you concerned with the?
I'm cautiously optimistic because it's only been 5 days, and
Okay.
as I've said, we're going to continue to see air traffic flow in Bermuda to keep our tourism and our economy going. However, I am also comforted by the fact that our testing regime is so aggressive that the borders are well protected by the fact that you must have a pretest if you are a visitor, and arriving residents who do not have a pretest will be required to quarantine for 8 days, so as well as continuation with their testing.
Thank you. On another note, Premier, with the government assisting GEMCO and the Southampton Princess Management last week with assisting their employees, do you think you might be setting a bad precedent? Because if another set of employers fall into the same category, what happens then?
Thank you, Trevor. Just first, I just want to answer the question which you'd asked before to the Minister of Health, because the Minister of Health says she's cautiously optimistic, and I share her exact view. And the fact is that we are fortunate to have this amazing testing regime here. The only way that we're going to prevent this from spiking up again is if residents heed what we have been saying, and that is to restrict your travel. It is a bad situation in the United States right now. It is a really bad situation where we're talking about record levels. I mean, I'm hearing about people planning shopping trips and all that other type of stuff. I mean, you get there, you never know if you bring something, maybe a taxi driver, maybe, someone in your household, you're quarantined because you don't have facilities, maybe it goes here. It's not a good situation, and I cannot urge the people of the country enough to, unless it is absolutely necessary and essential for you to travel, do not do it, please. All of us want to get on a trip. All of us do, but it is certainly something that I must reiterate, and that's the only way that we're going to prevent this. Our challenge certainly is persons are required to have pretests, and those pretest visitors are required to have pretests, but because residents are not, there is certainly that challenge. But as the minister has said, with this new facility at a place which will be accessible, we're hoping that more residents, if they travel, will be able to take advantage of a pretest.
Can I just
Sorry, go ahead.
I just wanted to add one more thing, Trevor, and I wonder whether, I'm not sure that people fully appreciate this particular aspect. It's one thing to travel overseas because you have a medical condition, or it's essential for whatever reason, you're returning a young child to school, etc. However, if you happen to be going away for not one of those reasons, and you come back to Bermuda and you're sitting on a plane next to somebody that is positive, you will then have to quarantine for 2 weeks. So therefore, you have lost your source of employment for 2 weeks. If, God forbid, you then become a case, every member of your family is now forced to quarantine. Whilst you isolate for 14 days, they have to quarantine for 14 days. So the economic impact on a family, because they decided to go on a shopping trip, is grand. Like the Premier said, we all want to go away. Every one of us is keen to get off the island and have a vacation and some rest. But you could adversely impact economically your whole family because of a frolic that wasn't necessary.
It's not worth it.
No.
To answer your question, and the Minister of Health has put it in the best in those start terms, and that's where it is. Certainly on the question which you asked, I first want to redirect your question, and I will say that we were not assisting GenCom. We were assisting the employees of the Fairmont Southampton Princess, the largest hotel property and the largest employer outside of government on this island, with a significant amount of persons who found themselves in a very difficult situation. Yes, that was a conversation, discussion about the setting of the precedent. I think the Minister of Finance laid it out very plainly and clearly the steps of which are being taken. It's important to note that clearly the government was involved in the process of getting it to the point of sale and making sure that we put an arrangement in place. So it's an important thing. But yes, it is a risk. However, with the record that the Minister of Finance has had, certainly when dealing with the issues of Caroline Bay, and he has made it clear that he will stop at nothing to ensure that the government gets its money back. So I don't look at it as assistance to GenCom. I look at it as assistance to those staff who, due to a pandemic, due to bad timing, due to other cases and situations, we're talking about 700 employees, Trevor. This is the largest employer outside of the government of Bermuda on this island, and I think that it's something that has to be recognized.
But we have another large hotel that falls in the same predicament. My question again is, do you think if they actually come up with the same scenario, are we not setting a bad precedent because they can see?
Here's the thing, Trevor. People can always argue that it sets a precedent, and that was a conversation, discussion which the government has. But oftentimes governing is choosing between two bad choices and choosing the least bad. We believe that it's less bad for people not to go hungry at Christmas. We believe that it's less bad for people who've worked at a hotel for 40 years to make sure they're able to get their redundancy payments. That's what we feel, and that's the side which we came out on. And it's a difference in approach between this government. We are a labor government, and we are going to support workers. We have the facility where we have persons on supplemental employment benefits. We have the facility where we made sure that we paid unemployment benefits to persons while we had closed down to make sure that work and income continued. And that's the decision which we made. I stand by the decision. I recognize the fact that some persons may say that it may cause a challenge in the future. We will deal with those issues as they come. But we believe that we've made the better decision because the other decision may have risks. The government will pick up the tab one way or the other.
My last question, we have a large amount of individuals that have lost their employment and have realized that they don't have pension due to their employers not submitting their pension funds that have been taken to the Pension Commission. What are the steps for one to take to inquire about the status of their pension? Receiving the pensions or recouping what belongs to them?
The first thing to do, of course, would be to check into the Pension Commission, but also I believe that by law, pension statements are mailed to each person who has, and I think they were mailed twice a year for private sector pensions. So individuals should certainly check to make sure that they are getting and those matters are being deposited. But if there's any questions about things that are not taking place, I encourage persons to speak to the Pension Commission. I will take a note of your question. You know, the Minister of Finance holds press conferences every 2 weeks, and I'll make sure that he addresses that specific instance the next time he speaks. But it is something that is certainly important. But individuals should go ahead and make sure they actually, sometimes we get mail, we don't look at it. It's important to go ahead and take a look to see whether or not your contributions are being made. And so you can see. I know that you can check your social insurance online, but for private sector pensions, you should contact your pension administrator or check the mail that comes in. I think it's at least once a year, but I think it might be twice a year, as is law.
Thank you much.
No more questions? All right, thank you. Well, we will certainly be here again next week, Tuesday, to provide a further update. At that time, we'll be giving an update on the latest of coronavirus tech. I'm very excited to note that our app has been approved by the App Store and Google Play Store, so we'll be giving the details of that next week. And we'll be back here again to brief the country on the latest with the coronavirus. Please, everyone, continue to remain safe. Please, everyone, continue to practice the precautions which are necessary. And please, everyone, continue to heed the pleas of the Minister of Health, who spelled out in very stark terms the consequences of traveling for non-essential items and what can possibly happen to your family in the case of if you were to contract the coronavirus. Before I leave, I'd like to wish a very happy birthday to my wonderful wife. I'm heading home to celebrate with the family. So with that, thank you all, and good evening, Bermuda.